Sorry.
Hi everyone, welcome to the panel discussion today by 𝐕𝐄𝐒 on World Immunization Week. And I am Dr. Mahima Bakshi, a maternal child wellness coach, author of Birthing Naturally and founder-owner of Birthing Naturally 𝐕𝐀𝐂𝐒. I have with me some amazing panelists today who will be discussing about role of vaccinations in children and mothers. So I would first like to introduce my panelists to all of you. My first panelist is Dr. Narottam Pradhan, Technical Director, Project Concern International for India. Hi, sir.
Hello. Happy
Welcome
to be
to
in
the
this.
panel discussion.
Yes, thank you so much. I'm very happy to participate in this. And here's looking forward to the discussion.
Thank you
You
so
want a
much,
little bit of
sir.
an introduction? I'm a public health specialist. About 2 decades in the field of immunization. I worked with many UN organizations, and currently I'm technical director for health and nutrition in a Bihar-based project funded by the Bill and Melinda Gates Foundation. Yeah, that's about me.
Thank you so much, sir. It's an honor to have you as one of our panel experts today. And I would now like to introduce my second panelist to all of you, Dr. Manu Chaudhary, Consultant-Paediatric Infectious Diseases, Rainbow Children's Hospitals, Bangalore. Hi, ma'am.
Hi, everybody. Good afternoon.
So would you like to say a few lines about yourself, ma'am?
Yeah, so I am right now in the midst of managing a lot of COVID patients. And of course, what we are seeing is people who got COVID vaccine are actually doing very, at least they're not getting severely immunocompromised or getting sicker being in ICU. So very apt. I can definitely fill in regarding the clinical part and, clinical aspect of vaccinations.
Thank you so much for joining for today's panel discussion, ma'am. It's an honor to have you. I would now like to quickly move on to my next panelist, Dr. Sanjay Wazir, neonatologist and pediatrician, Cloudnine Hospitals, Gurgaon. Hi, sir.
Hello, hi, Mahima. And I'm Dr. Sanjay Wazir. I'm a neonatologist in Gurgaon and been there for almost 15 years now.
Thank you so much, sir. Would you like to say a few lines about yourself and this panel discussion today?
Sorry, I lost you somewhere in between. Can you
So would
please
you like to
repeat?
say a few lines about yourself and today's panel discussion?
Oh yes, like as I said, I'm a neonatologist who's working in Gurgaon for the last 15 years, and I work in Cloudnine group of hospitals, looking after the NICU. And vaccination is something that which as a pediatrician, as a society, as a nation, that we must promote. We have been promoting COVAX vaccinate to COVID now, and we know how many lives can be saved by just one preventive action, which is vaccination. And during the pandemic, when people started not taking vaccines because they were fearing corona to their children, at that point in time, WHO estimated that almost 117 million children would be at risk of measles, which is like, and I'm just talking of one disease, and has a mortality of around 4 to 10%, which means the COVID, which has a mortality of maybe 1%, and a disease which is more rampant, has a high secondary rate. And this is similar with other things also. So it's important for platforms like these to spread that message that we need to get our children vaccinated in the larger context of preventing diseases other than COVID also, which will loom large once this pandemic is over.
Thank you so much, sir. Now I would like to introduce my next panelist, Dr. Rohit Arora, Clinical Director and Head Neonatology, Apollo Cradle, Gurgaon. Hi, sir.
Yeah, hi. I'm Dr. Rohit Arora. Thanks for having me here. I'm a neonatologist and a pediatrician working here in Apollo Cradle for the last 5 years. And looking forward to the discussion. Vaccination, as Dr. Wazir also mentioned, it's a huge public health. It's in public health domain, and it's one of the best preventative measure which is possible throughout the globe. It saves lives. And in this current era of COVID-19, it has really brought forward the importance of vaccination, as there are no treatments per se, standard treatments available, and the vaccine is, everybody's looking forward to the vaccine and it's working or not. So yeah, looking forward to the discussion from the experts.
Thank you so much, sir. And I would now like to introduce my last panelist, but most important, because she's from the field of gynecology. So Dr. Astha Dayal, lead consultant gynecologist, CK Birla Hospitals, Gurugram. Hi, ma'am. Hi, ma'am. Can you hear me?
This important topic that you've chosen today, and seeing the situation of COVID, it's the right time when people will understand the importance of vaccination. And there are a lot of maternal vaccines which are not even known. And I think it's a good opportunity for people to learn about these vaccines here by attending this panel.
Thank you so much, ma'am. So now I would like to take the panel discussion ahead. And as our topic for today is, simply put, vaccines save lives. Childhood vaccines save an estimated 2 to 3 million lives worldwide every year. Vaccines are found to be the most cost-effective approach for reducing childhood disease burden, especially when compared with interventions such as clean water and improved sanitation, which can also reduce disease transmission. Cross-national policy efforts such as the WHO expanded program on immunization of 1974 and the multi-agency Global Alliance for Vaccines and Immunization have supported several countries with research, logistical planning, supply chain management, and financing of national vaccination programs. In recent times, routine vaccinations has been supplemented with additional efforts to optimize community coverage. An example is the Government of India's Mission Indradhanush campaign initiated in 2015 that resulted in an increase of full vaccination coverage in target districts by 10 percentage points in just 6 months. As a result of these combined in-country and international initiatives, full vaccination rates of children in low-income countries have increased from 50% to close to 80% during the past 2 decades. Now, I would like to open the panel for discussion. My first question is, vaccine hesitancy is believed to be responsible for a decreased vaccine coverage and an increased risk of vaccine-preventable disease outbreaks and the epidemics. Do you think this has been a factor while you've been dealing with your job? And I would like to present this question first to Dr. Sanjay Wazir. So, Dr. Sanjay Wazir.
Can you repeat the question, because I just lost you some?
Sure, sir. Sure, I'll just repeat it. Vaccine hesitancy is believed to be responsible for reduced vaccine coverage and an increase of risk of vaccine preventable diseases. So, do you think this is a factor while you've been dealing with your job?
So, vaccine hesitancy has been, once it started, there are obviously being people who are for and against vaccines, and the world is replete with the umpteen examples when any new thing which is introduced, you will have probably reservation by other people, or you will develop a cult who would probably may not be scientific, but yes, they would start coming against the vaccines. And we have seen right from the smallpox vaccines when it was started in United States, and people who were Orthodox Jews, they were against the whole idea of vaccination. And there are certain areas in New York still who would probably be against the whole idea of vaccinating because they think it's not natural. And obviously there are people in India also, when the polio vaccine was rampantly scaled up by the government, at that point of time, there were people who were against the whole concept about, about the whole concept about, having less of vaccination. And also, then the other thing that we need to now realize that there have been certain reports where people have linked MMR to autism, whether based on some studies which were ill-founded and completely unscientific. But yes, there have been voices of vaccine, unfortunately, I would say, vaccines not to be taken up by children because they feel the number of jabs have increased and that may lead to some other pervasive developmental disorder. But one of the simplest, as you rightly pointed out, simplest intervention which has saves around 2 to 3 million children across from deadly diseases is a vaccination. And some 45% of the world's children under 5 are at present reached with life-saving vaccines, and the others are not reached. And in fact, if you look at the data from the UNICEF, they clearly say that, like, almost, you take an example of polio, for example, since 1999 or 1998, 88, sorry, the number of polio cases has decreased by 99%, one of the most crippling disorders of childhood. And measles vaccination itself has averted somewhere close to 23 million deaths between 2000 and 2018, which is quite a staggering figure when we look at public health as a strategy.
Right, sir. Right. And Dr. Astha, ma'am, would you like to add something more to it from gynecological point of view?
Yeah, so actually, when a pregnant woman is coming to us, that's a very good opportunity to vaccinate her because she's very concerned about the health of her child as well. So the government of India has this immunization suggested for pregnancy, which is tetanus, which they've actually implemented close to 100%, and which has helped in eradicating the neonatal tetanus. So there was no, I think, hesitancy in terms of tetanus vaccination is not really seen. But the other vaccines which are globally recommended, yes, there is some vaccine hesitancy because the women are concerned about the safety of the vaccine, the efficacy of the vaccine, and the need for the vaccine because they're not in the national immunization program. And of course, there are minor issues like women don't like to get a needle prick every, like in the pregnancy, or there are familial barriers. Their parents or their in-laws are not allowing them because they know that only the tetanus vaccination is what they're supposed to take in pregnancy. But the government has successfully inculcated in all pregnant women that the tetanus vaccine is essential, and I think that everybody is ready to take. So I've not noticed any hesitancy in that.
Right. Thank you, ma'am. And I would like to come back to Dr. Sanjay Wazir, sir. So what do you think is the effect of this pandemic and the lockdown that we had faced last year and then again this year, especially on infant and maternal immunization? Dr. Sanjay? Sir, can you hear me?
Yeah, see, I tend to lose you in between. Can you please repeat the question? I just lost you in between again.
Yes, sir. So my question to you is that what do you think is the effect of this pandemic and the lockdown on infant and maternal immunization?
So as I told you last time, in the previous discussion also, a couple of minutes back, there is a hesitancy among people to come to the hospitals or visit the clinics to get the vaccine done. And that is impacted, there is leaving a large chunk of babies who are at a higher risk of developing, life-threatening disorders, including diphtheria, tetanus, and other, kind of measles, for example. And if you look at measles alone, as I said, there is almost 110 million children at risk of developing the measles once this pandemic is over. And the similar figures would be for other conditions like diphtheria and pertussis, for example, would increase significantly. It is important that we kind of emphasize, and at least for the primary immunization is still continued during the pandemic, and that is something that we need to be like looking at very seriously from a public health point of view. Even the government facilities right now, you children who go for a government initiated programs also, they are not either finding the health workers or probably the people not coming or even not traveling to the villages is something which is concerning. But I'm sure that is something which we collectively have to look at a solution to that problem.
Right, sir. And now I would like to move to Dr. Rohit. So, sir, I would like to present my next question to you. Why vaccines matter? Understanding the broader health and child developmental benefits of routine vaccination.
Yeah, okay, thanks. So to understand how vaccines have an impact, we need to understand our own immunity first, how it works, right? So we have a pathogen, it comes into our body. Uh, it tends to create the disease process, and our body is designed to handle that pathogen. How? By producing certain kind of proteins called as antibodies, right? So that's how our body tends to defend us from these pathogen. But there are two problems with this. One is sometimes because it's a new pathogen coming to the body, the antibody formation can take time, and during this time there can be a disease process which leads to morbidity, and it can progress to even deaths. So that's how diseases happen. So you must have seen, not everybody for a same disease, everybody has the similar kind of picture. Some develop mild disease, some are totally asymptomatic, some develop severe, some die, and rather I would say most people actually come out of it, of most of the infectious diseases, because our bodies tend to handle them. But sometimes it takes time for the body to react, and then during this time period it tends to the body gets overwhelmed by the pathogen, and therefore the disease happens. Now to mitigate that, vaccines are designed to be inoculated into the body so that they are weakened enough to not produce disease, but at the same time they are strong enough to mount a immune response, right? So it it has a two-pronged effect. Again, by not producing a disease, at the same time it produces immunity against those pathogens. And also body tends to produce memory cells, so that in future when the same pathogen tends to attack, our body is already prepared now, well prepared to fight against that particular infection, because we have the so-called memory cells into our body which can stay up to years together, right? So in future, in few years down the line, or many years down the line for that matter, depending on the kind of disease we have, body tends to remember that pathogen, and then mount an immune response adequate enough to avoid disease formation. So that's the basic principle of how vaccines work, that they would induce an artificial infection kind of a situation in our body without actually causing a disease, but making our immune system ready to fight in case future any infection happens, right? So this is the best possible, without having a disease, you get the protection, right? So yeah, so that's how they work. Now, so this leads to so many benefits, right? We don't get any diseases, so reduce number of hospitalizations, right? Reduce number of medications, reduce use of antibiotics, right? So these are direct effects, and of course cost which is involved. The indirect effects would be, right, so decreased absenteeism from the school as far as kids are concerned, decreased absenteeism of the parents from their jobs, right? And of course, as you also mentioned in the beginning, right, the total number of deaths which are prevented from the globally is to the tune of 2 to 3 million per year, right? I would say WHO latest report I was going through, it actually says 6 million deaths are prevented because of vaccine preventable diseases. And in spite of all these efforts, in India, 5 lakh kids less than 5 years of age actually still end up dying because of these infectious diseases every year. So there's still a lot of scope for improvement as far as vaccination coverage is concerned, right? So huge number of benefits of doing these vaccination programs.
Right. Thank you, sir. And I would like to ask Dr. Manu. So, ma'am, how do you think that people, can be made more aware about the importance of regular vaccinations?
I think as pediatrician, we keep honing on this fact because already we discussed the numbers, how morbidity and mortality has come down. Uh, Whenever there is a vaccine hesitancy case, I remember one of my very senior ID physician from Texas. She used to say, whenever somebody tells you no for a vaccination, tell them we have seen, polio cases where we could not save them, who actually went on to ventilators, and we still see unvaccinated children getting very bad brain infections. They survive because we help them with antibiotics, but their rest of their life they live with a very bad morbidity, right? They will have mental retardation. They'll probably have physical challenges as well, just not for the patient but for the whole family. So we usually give them this other aspect of things where we are at the receiving end of seeing these patients who are not getting vaccinated. So definitely at pediatricians, we are sharing and making people aware of the importance of vaccination. COVID itself has bring out the whole concept very strongly. As soon as in India, we already are out of stock with our vaccination. I know we probably gonna start revaccinating again, but COVID had shown very clearly none of my severe COVID patients are those who received appropriate vaccination. So this will definitely increase the awareness in the public regarding vaccination. And then I think platforms like this, Voice of Healthcare, discussing the importance of vaccination again will be making more people aware. So I think it's a continuous dialogue. We should keep going on. We should give concrete numbers to these vaccine hesitant people, and just keep going in with the good word about what positive we have seen and received. And the other point which I really wanted to bring to everybody's notice is there's something called herd immunity. So in younger children who cannot get a particular vaccine, so chickenpox vaccine we can't give before 15 months of age. They're immunocompromised patients who are cancer patients, where we have to hold on their vaccination. There are transplant patients where we can't give a particular type of vaccine. Herd immunity is if you have vaccinated enough people in your population, then that chain of transmission is broken. So we are protecting our vulnerable population as well with these vaccination, and that has also to be put out there to make people aware the importance of these vaccination, apart from how they are acting so positively towards bringing down the mortality, bringing down the morbidity, and improving health for the child and the family members.
So that's some great information that you've said, and of course, I'm sure that a lot of parents are also going to benefit from it and understand that how important it is for them to take their kids for the vaccinations on time regularly. My next question is, with improvements in vaccination rates and reduction in child mortality, what are the significant future changes in the global child health policy that can be envisaged? I would like to present this question to Dr. Narottam, sir.
Yeah, thank you. You talked about, looking at future. And I think sometimes, a situation like the COVID situation now, it reminds us it's so difficult to forecast the future. Why I'm saying in policy, vaccination has taken a large chunk of, child health investments and, strategies and approaches. I know Government of India has an immunization division. Very few public health programs are funded as well as the immunization program. Having said that, vaccination essentially is for infectious diseases. And India is still, a large portion of diseases in the children are still infectious. In the Western world, it's changing. Infectious diseases may not be the chunk of the pie, but even in India, in the last 2 decades, as you said, vaccination has done pretty well. But if you look at the national average, it's like 70%, and that means 1 in 4 are roughly unvaccinated. So there is still remaining, and as ma'am just said, we'll have to step up our vaccination rates to bring that community or herd immunity. And having said that, you brought the question of where is the policy change. If you look at India's childhood mortality, the chunk of children dying are now more in the newborn period, where there are very few vaccines effective. One vaccine which is effective, which ma'am talked about, is the neonatal tetanus, which now India is eliminated since 2015. So there was a shift in, a focus on newborn health. And there is some focus on also undernutrition and childhood development, which go quite closely with child health. But you can never say, like this COVID has shown, and not only is infectious diseases on the rise, that a pandemic like this takes away the opportunity to vaccinate children, and there are new cohorts that come out. And as Dr. Sanjay, I think, mentioned, measles, which we were patting our backs, we've done pretty well, almost going towards elimination. Now there are new cohorts which are susceptible to vaccine because we've not been able to vaccinate that. So, there are changes in policy at the global level looking at more non-infectious diseases. But I think India, in terms of our country and India, will have to stay firm of infectious diseases while also concentrating on other areas like newborn health, like malnutrition, like overall childhood development. So that's it for now, and maybe we can discuss further later on. Thank you so much.
Yeah, in
Great.
future also, infectious is one of the easiest thing which can be controlled is the cervical cancer. That's another area of future development, because right now, as a national policy, we do not have that in the EPI schedule. But in future, for example, that is one intervention which can reduce the chances of having cervical cancer by 70%. And I feel all adolescent females, if the parents are listening, should go for a cervical cancer vaccine in addition to the infectious diseases which Dr. Narottam just mentioned.
Right. So absolutely, cervical cancer vaccination can also be another great vaccine drive that can be initiated by creating more awareness to ensure that parents get it done for their children. And I would like to get back to Dr. Narottam again. So how do you think that the role of vaccination can take part in the economic growth of the country?
See, as we've seen right now, if you do not get vaccinated, you get ill, you lose those days of working days, and also the entire family is involved. That's what we see once you get infection. So if you get vaccinated, you are able to avoid all of that, as much as the vaccine works. So in terms of economics, you are number one, I did a very rough calculation from data that was available to translate it in rupees. For every 100 rupees of money spent on vaccination, you are saving 1,500 almost as the immediate consequences. You don't get sick, you don't lose out on work, and you are able to earn. The family members can even earn on that. And leave alone the costs of illness, the cost of vaccination, the cost of lives lost, all of those, all accumulate. Long term, if you look at, there was a calculation I was again looking at, for 100 rupees invested, vaccination roughly gives you almost 50 times more, 500 times more returns, because the number of children in the cohort who get educated, who can earn later in life, say for example, polio, if you were disabled, you cannot do something, measles, you die. So the entire life expectancy of what you could have done, we call that there is a indicator or disability adjusted life years or quality adjusted life years, which brings out the long-term benefits almost in terms of productivity of any public health intervention. And vaccination is known to be one of the most cost-effective interventions. And as a public health person, I know we do a number of public health programs. We do for malnutrition reduction. We do for newborn mortality reduction, and vaccination is one of the easiest in public health. Because you have a sure shot. One vaccine you have, you just need to ensure that it reaches to the last mile to a trained person, and cold chain is maintained, and you administer the shot. Of course, there are issues of vaccine hesitancy and supply chain and quality, but not as much as other public health programs. And that way the investment in vaccination is not only having short-term returns in terms of economics, but also very long-term returns. Someone actually said that three things: one is breastfeeding, the second is education, and I think the third is vaccination. These are the top three interventions in the development sector that bring maximum return on investment.
Rightly said, Astha. I totally agree with you. So absolutely, there needs to be more investment into newborn vaccinations and the awareness to be spread upon the future health of these children, which will also help in improving the economic growth of the country. So apart from the adolescent aspect of the vaccinations, the newborn baby aspect of vaccinations, now I'll move on to the maternal aspect of vaccinations. So my next question is, improving rates of maternal immunization. What are the challenges and the opportunity? I would like to present this question to Dr. Astha.
So, I think when a pregnancy is a very good opportunity to educate patients about vaccination, because most women will be visiting their doctor the first time and probably the only time when they're pregnant. So we need to tell them about vaccination during pregnancy, but besides that, we should also educate them about other vaccines which they can take outside of pregnancy. Like Dr. Sanjay Wazir mentioned, the cervical cancer vaccine, which is a life-saving vaccine, but most people don't know about it. So the cervical cancer vaccine, the MMR vaccine, the chickenpox vaccine, the other adult vaccination which can be done after their delivery or should be done before they get pregnant should also be informed to the women at that point of time. Now, talking about the vaccination during pregnancy, we don't generally give live vaccines in pregnancy. So the vaccines that are recommended in our national program is the tetanus vaccine, which is well covered. Besides that, global guidelines also recommend the flu vaccine and the Tdap vaccine, which is the whooping cough vaccine. So the barrier or the challenge here comes because most women are not convinced about the vaccine because they don't know the severity or the burden of the disease of the flu. So unless we had the H1N1 pandemic, I don't think people knew that the flu could be so serious, and they were not open to taking that vaccine. The second thing is that they, like the pertussis vaccine, you have to tell them that if you get the vaccine in the third trimester, you can give a passive immunity to your child in 2 weeks. And the child can catch whooping cough in the first 2 months of their life when their vaccination is not complete. So this vaccine is very important, but it is not a part of the national program. So it is not very well covered. In fact, we are practicing in a place, in a metropolitan city where people are educated, they are affording, so, and they read global guidelines and global recommendations, so they are open to still taking the vaccine. But the reach of that vaccine to smaller places, because in most of India, an obstetrician probably will not be doing a delivery, so it will be a healthcare professional or an Anganwadi worker, so they are not aware of these vaccines and they're not convinced about these vaccines themselves. So I think a big barrier is this communication to understand and to address all the doubts of the pregnant woman, but also communication amongst the healthcare professionals to have a standard guideline and not the ambiguity or the uncertainty amongst doctors themselves about giving these vaccines. And of course, then there are the system issues because these are expensive vaccines and we need national programs to cover, especially the cervical cancer vaccine is an expensive vaccine. So we being a developing country do need to prioritize, but at least the life-saving vaccines should be considered in the national programs, because unless there is pressure from the system, and there are a lot of issues on trainees, because not every doctor will be able to give that vaccine, and small workers in the villages should be trained to give those vaccines, then the cold chain maintenance, then the price, everything is an issue. So those are the main challenges. But I think with time, as now that people are understanding the importance of vaccination with COVID vaccine coming in, I think the uptake will be much higher. And also the the uptake, the hesitancy is basically depending on the severity of the disease. Like unless in January, I think we were also hesitant taking the vaccine, but now that we've seen the second wave, I think nobody is hesitant about taking the vaccine. So it's the severity and the burden of the disease which really drives the vaccine uptake.
And I would like to add to Dr. Astha's point. So ours is a pediatric as well as a maternal hospital, tertiary care hospital. And in our second peak, we are seeing this virus impacting our pregnant females as well. And I know Ministry of Health initially had said against vaccinating pregnant and lactating mothers, but we now highly recommend, CDC says it, ACOG says it. So I highly recommend our pregnant females and our lactating mothers as well getting vaccinated, because COVID is impacting everybody now, and it's actually more at higher risk more than general public.
So I totally agree with you. Last year the strain that we had was not as bad, but this year I have myself seen so many miscarriages, so many ICU admissions. So pregnancy is a high risk situation. If a pregnant woman catches COVID, she's more likely to end up in an ICU. So vaccination is very important. But so this is where the ambiguity is coming in, because the Ministry of Health and Family Welfare puts pregnancy and lactation as a contraindication to this vaccine, because they've not done any trials on pregnancy and lactation, which is justified because they've not tried it on pregnant women. But our FOXI guidelines are saying that every woman has a right to take this vaccine, whether or not pregnant. And we have to have this discussion with her that it is an inactive vaccine, it is not a live vaccine, it is a safe vaccine theoretically. There are not enough trials, but it is life-saving for you. So you should have this discussion with your doctor and take the vaccine. That's what we are telling all the pregnant women.
Absolutely. So what happened was when they did trials almost 20,000 pregnant females who were not aware that they were pregnant, and most of them have been doing fine so far. So yes, the trials are limited, and sometimes we might not get to the trials for pregnant females. But as Dr. Astha said, this is a time where we have to save our people. Then keep waiting for the trials to happen, and there are active trials going on in pregnancy now. So probably more data.
So actually, the international recommendations were about the Pfizer vaccine or the Moderna vaccine, which had been tried in pregnancy. But the Indian vaccines, they're saying that they've not really tried and recommended in pregnancy. So the vaccine
has no trials, but rest of them, they have had pregnant females who didn't realize they were pregnant, and they have those data. But again, as you said, at this point of time, it's about saving lives, and they're all dead. None of them are active viral replication, so should not impact the embryo. It does not cause infertility. So we have to send that message across.
So that is what I think the government should also take. A clear message to everyone. Because globally, I don't think we've had any effect of any vaccine affecting the fetus in a bad way ever. Even if somebody had a bad effect on the fetus. So I think it's absolutely safe to take.
So yes, continuing that discussion on whether it's okay for pregnant women and lactating women to take the vaccine in India or not to take it, I think it's best to just discuss with your gynecologist, because there are a lot of different opinions coming on it. Somebody is saying the Pfizer vaccine is safe, and somebody is saying that there are still discussions going on whether the Covishield and Covaxin can be taken or not. So I think best is you can discuss with your gynecologist and go ahead with taking the vaccine. Now I'd like to move on to the next question. So since we were discussing about the COVID vaccine and all these, the pandemic times that have opened awareness on the role of vaccination due to the second wave that has hit us. So what do you think is going to be the impact of these pandemic times on the awareness on maternal infant immunization on the general public? I would like to present this question to Dr. Manu.
What's the question? I didn't get it.
So ma'am, with these COVID times going on, there's been a lot of awareness and talks going on about the COVID vaccination. So do you think that this is going to also affect the awareness on maternal infant immunization?
Absolutely, right? So the hesitancy is going down now. As Dr. Astha so nicely put it, when they see the burden of the disease, when they see the lethality of the disease, uh, that's when people really go ahead with some of these interventions. So definitely COVID is gonna help. I personally feel uptake of vaccination in both the group, in infants and as children, as well as in maternal population. What we have to understand is, because for COVID we are seeing it, but for other, so like measles, Haemophilus influenza, chickenpox, not general public does not ever get these numbers very clearly. Most of the physicians or public policy makers who know these numbers. So for those, we still have to keep making people aware, keep having the drives, keep having social messages through media. So that needs to keep going on till that, you know, thing becomes really an issue. And I feel in future we are going to see more and more of such, infection related um, massacres. I must put it the way. It's sad, but it really, I think the earth is under pressure, and we just have to be up. It's a virus against humans, right? That's what we are seeing. So we have to. They're going to be one step ahead of us. It mutated. We are seeing three mutants in one virus. So again, as humans, our achievement has been to get the vaccination up and going. It's remarkable time period where we got our COVID vaccine because of all the technologies we have discovered. So we have to keep that balance between, you know, preventing the disease, managing the disease, and making people aware of the real figures so that they make an informed decision for them and their children.
Right, ma'am. And I would also like to take an opinion from Dr. Rohit. So, sir, what do you think is the impact on the maternal infant immunization of these COVID vaccine talks that are going on?
Yeah, so as has been discussed, the awareness is definitely up. People are talking about vaccination all the time, right? It's all over the news, media, everywhere. People are discussing whether to take, not take. So awareness is for sure up. So hopefully the other vaccines will also be talked about, but we have to be careful a little bit about the. So I'll just give you an example. During the polio, when it was on its peak, the polio vaccination drives all over the country, and there was so much of. So I'm just showing the other side of the coin. There was so much of media discussion about polio vaccine that the regular DPT vaccine actually took a hit during that time, right? And so much so that government has to actually come up with another campaign talking that it's not just the polio vaccine. You have to take along with other vaccines. Polio is important because DPT vaccine actually took a hit at that time. So yeah, awareness has to be comprehensive. So policymakers, Dr. Narottam can maybe highlight more, but other vaccines, this aspect has to be careful because everybody is set at home. Nobody is walking out. We are getting messages left and right as pediatrician whether we should come out and get our child vaccinated because they are due. We are getting such messages every day, hundreds of them. The ones which are, so all of vaccines are important and their timing is equally important because unless you follow the timing, you can actually lose the benefit which has happened for the previous vaccines you have given, some vaccines, right? So we need to tell parents about the importance of timely having these vaccines, right? So yeah, social media and all these mass campaigns do have its effect on the people. Recently, there was an outbreak of Japanese bee encephalitis in the eastern UP and Bihar, right? So everybody poured in to get the Japanese encephalitis vaccine. So all these do play a role on the people's mentality. So we have to be carefully driving this thing because it has a social impact. It's a mass impact it can have. So yeah, you can utilize this awareness to increase the vaccination, other vaccines also.
I totally agree with you.
Yeah, I can add to that. If you look at the public health system, we have limited human resource, in terms of vaccinators, in terms of facilities. So urban area is one thing, where, a large portion of, vaccination is undertaken in private setup. But rural areas, it's still dependent on the single public health system. And when, one is the burden of the COVID itself, the other is the focus on preventing COVID through vaccination. So maternal and child health vaccination has taken a hit, in a sense, as Dr. Rohit just said, because the focus was so much on polio, the others got compromised. Likewise, because the focus is so much on COVID, the regular vaccination is being compromised, because it's the same A&M, it's the same PHC, it's the same cold chain system, and they are stretched, as we know. Only the hope is that in the long term, because the general awareness of vaccination has gone up, we can kind of piggyback on this awareness and transfer that awareness to vaccination of mother and children. But as of now, things are stretched, things are difficult. Vaccination, routine immunization is being compromised for maternal and child health.
Absolutely, sir. I agree with you. In fact, since I have such great panelists present here, I would also like to bring up this another point that a lot of lactating women, because they heard that it's not safe to take the vaccine with the breastfeeding going on, a lot of breastfeeding moms are wanting to give up on breastfeeding because they want to go and get themselves vaccinated to protect themselves and the family. So do you also feel that this is going to have an impact on too much focus going on the COVID vaccine and, the other aspects of maternal child health being neglected, for example, continuing breastfeeding? So would you like to add on something to that?
Yes, again, you talk about breastfeeding, but generally maternal and child health is compromised. India has this big program called Janani Suraksha Yojana, where incentives were given for institutional delivery. And it's not just institutional delivery, it's also, initiation of breastfeeding immediately after birth. So with this, hospitals being overloaded, again, even institutional delivery itself has taken a hit. In terms of breastfeeding, it's essentially a practice that's undertaken at home by the mother. I'm not sure right now how much that has been impacted, but the early initiation of breastfeeding, which is linked to institutional delivery, certainly is impacted.
Yes, sir.
So, Dr. Mahima,
I would just like to add that we are even allowing a COVID positive pregnant lady to breastfeed. So she has to wear a mask and she has to breastfeed. She may not room in with her child. Some other COVID negative caregiver can take care of the baby, but she should still breastfeed. So even if you're COVID positive, if you're allowed to breastfeed, then why not take the vaccine and breastfeed?
Yeah.
Right. So, Dr. Manu, you wanted to add on something to it?
Same thing what Dr. Alza said. We are allowing our mothers and we are actually encouraging them, COVID positive mothers, to breastfeed, because at least some antibodies will be, passed on to the newborn. Again, the hygiene has to be really, really important. Wearing a mask, cleaning the breast, hand hygiene, and lactating mothers, again, the antibodies will be transferred to their newborns or their infants. So please don't stop breastfeeding.
So absolutely. So definitely, I feel that all the other aspects of maternal health and infant health immunity should be clarified. And it's not just talking too much about the COVID vaccine, but also the other aspects of maternal infant immunization needs equal focus to be maintained as well. So let's take the final take from all of you. The final question is, what do you think is the effect of this pandemic, the lockdown, and how maternal infant immunization can be protected by ensuring that parents bring their children for the vaccines on time, or if probably hospitals can come up with home vaccination programs and ensure that kids are vaccinated safely at home. So I would quickly like to take a final take from all of you. I'll start with Dr. Narottam, sir.
Yeah, as I said, the public health systems are stretched. And since the COVID has happened, vaccination usually takes place in a gathering in village areas. And government is taking vaccine to every village in India as of today. They have, linkage workers called Ashas who go home and call the, children and the mothers to the vaccination site. And that's a very well-oiled machine if you look at it. And it's phenomenal what government has done in reaching every village and almost every home. But of course, COVID has compromised that because, Ashas have multiple job responsibilities and now they are getting enriched into the COVID-related duties. A&Ms have multiple responsibilities. So, of course, this period has to pass. We cannot say now dump COVID and look at maternal and child vaccination. Of course, that's not said. but we'll have to wait our time. Bring out strategies where we can reach out, do vaccination along with COVID, follow the COVID appropriate behaviors during vaccination sessions, and work out and hopefully pray that the surges will come down and normalcy to some extent will be returned. So it's a kind of a iffy situation right now, and I wouldn't want to jump in recommending anything, but slowly and surely we'll have to bring up and pull our reins on maternal child vaccination, all the while keeping a strong a hold of how we can prevent COVID and manage COVID patients as well. So that's it from my side. Thank you so much.
Thank you, sir. Final message from Dr. Rohit.
Yeah, as Dr. Narottam said, at the policy level, it's the policy people who have to jump in, ensure that the vaccinations keep on happening. You need more hands, need to recruit more people, utilize the opportunity of COVID vaccination and, tell people that, at the same time have some kind of, placards over there or, brochures available that, keep alongside, don't forget to get your child vaccinated. At our level, at pediatricians level, we have a pool of patients. We can, just send them customized messages. Please don't forget to get your vaccines. Of course, COVID comes first, but then they are also important. Please don't forget that. And the ones which cannot be missed, some kind of home programs can be established, something like that. So we cannot leave it for sure, but otherwise the benefits which we have done over a past some time, they are likely to get lost. And also we don't know the duration, how long COVID is going to last. So all the more reason that we need to kind of come up with some or the other policy towards this as well. Yeah.
Thank you, sir. Dr. Manu,
Arora.
please. Dr. Manu, please.
Yeah. So I think here my suggestion would be, I think the public sector needs to help as well. So I think we should, as private hospitals and single owned nursing homes or clinics, I think we need to step up as well. Somehow maybe all these, and this is just a thought, Dr. Narottam, maybe all these without cost vaccination, if they can be given through these private sectors as well. Right now we are in a peak, so I am suggesting my patients to still hold off for a month or two, see how things are going, and then do catch-up vaccination. And as you guys have already mentioned, right, we need to have some COVID appropriate safe vaccination camps within the residential setup, within, like we set up camps for our patients in their residential communities, so that can be taken up. But again, right now it's a peak, so we are saying to hold off coming to the hospitals. Probably once the peak starts falling off, then the catch-up vaccination should be done, and maybe public and private can work together to continue the other important.
So on that, the Government of India's vaccination program is called the Universal Immunization Program. So effectively, Government of India procures vaccines for every child in India, irrespective of the social economic status, irrespective of geography. So every child, Government of India procures free vaccine for, and that is available. And not only vaccine, even the syringe, it's called the auto-disabled syringe. So it's only one-time use syringe is available. Vaccine, every vaccine comes with a vaccine vial monitor. So you know the quality of vaccine at point. So these are three benefits. Now, as far as public and private vaccine, in fact, because public health is a state subject, the state government actually decides that. And I worked closely with some state governments, and in some cities, we have actually given private, nursing homes and private hospitals vaccines free of cost. We've even given, we've had advocacy to give syringes free of cost, and the private provider can take service charges, but not charges for the vaccine. So those arrangements have been made, but I think those are an exception. But let me tell you that government does procure vaccine for every child free of cost. And let's hope that local governments are conducive to some of your suggestions and some of what we have tried before.
That would be wonderful.
Thank you, sir.
And hence the theme of this year's World Immunization Week, right? Vaccine brings us together and closer. So I hope, yeah, that's all from my side.
Thank you so much, ma'am. Now I'll take the final message from Dr. Astha.
Dr. Astha, you're muted. You'll have to open your...
Ma'am, we can't hear you. Can you please unmute yourself?
Sorry, I just said that so because of the lockdown and because of more of virtual visits, there is a little hesitancy in coming to the hospital, but still pregnant women do have to come for their essential ultrasounds or their checkups. So we are clubbing all the vaccinations with those visits, which are reduced to maybe 3 or 4 during the entire pregnancy in the second half of the pregnancy. So we are covering the vaccination at that time, and since women are more aware of their health now, they are more open to that vaccination. But I think, of course, coming to the hospital just to get the vaccine, it's like a double-edged sword nowadays, and women are keen on getting like a home vaccination or coming to smaller clinics where there's less of exposure. So that is a challenge nowadays. I think, which is a temporary thing. Maybe in a couple of months, we will be better off.
Thank you, ma'am. And final message from Dr. Sanjay.
Yeah, I agree with everyone that we need to step up the program for vaccination. And in fact, in Cloudnine last year, when the pandemic started, we started a concept of something called a home vaccination, where the doctor would kind of write a vaccine after consultation on video, and the nurse would go home and then vaccinate the children at home, just to continue the services to the newborns and ensure that at least whomsoever we can contact, for sure that service is provided at home to them, so that even during that time they did not have to come to the hospital. The vaccination can happen at home, and I'm sure this model in a different format can be followed with by different organizations, different NGOs, where eventually in the public health system also is the nurse or the Anganwadi worker who keeps giving the vaccine to the child. So this is a replicable model in a different format, different parts of the country, for sure.
Thank you so much, sir. So on that note, I would like to pass on this message to everybody watching us right now, that if you're pregnant, don't forget to go for your maternal vaccinations. Talk to your gynecologist. You can club it with your scan so that you keep your visits to the hospital minimum in these tough pandemic times. If you have a baby in the house, don't forget to get your child vaccinated on time. Talk to your pediatrician about it. Find out from your pediatrician if there is any home vaccination program available by the hospital. And while everybody talks about the COVID vaccine, don't forget the other vaccines, which are also important to save lives. And on that note, please do not stop breastfeeding. If you turn out to be COVID positive, continue breastfeeding your baby, because it is important for your baby's immunity. So I would like to thank all the panelists for joining in for today's panel discussion. It was wonderful interacting with all of you. Thank you so much for joining in.
Thank you so much.
Thank you. Bye-bye.
Thank you so much. Bye-bye.